podcast says that he sees life in black and white, but not literally. We'll explain.
So there's a good chance that there's someone you know who is suffering every day, like our friend Chris.
I want to be a broadcast journalist. Want to be in your shoes right here.
Is that right?
You
You
want to
bet.
take his
You're
job?
well on your way.
We'll see. Who knows?
Chris, for the next 45 minutes.
Look at the Speedo. My
He's going to be
goodness.
riding with his Speedo.
We didn't know it at the time, but Chris Biehn, the good-natured intern we had become so fond of, the one who always wears a bow tie and even served as a swimsuit model for us, was suffering from bipolar disorder. He was diagnosed in his freshman year of high school. Well, now the 21-year-old says he became manic. He says he didn't act or think the way he used to, and he ended up in the hospital. Well, since then, Chris has been working with medical experts to combat what he calls the chemical warfare going on every day in his brain. 1 in 10 Americans are depressed, but many keep it to themselves. Chris is breaking his silence in hopes that others will realize they are not alone and that there is always a reason to keep fighting.
Hey, Chris, welcome back to Good Day Philadelphia.
Thanks, Mike. Thanks,
Good
Alex.
to see
Pleasure
you.
to be here.
Yeah, and thanks for talking about this. You're a psychiatrist and also, hi, Claudia. Thank you for coming in as
good
well.
morning. Good morning.
I guess right off the top, before we talk to Chris, I have so many people say, I think I'm bipolar. What is that?
Bipolar is a serious biological mood disorder where patients experience episodes of depression and episodes of mania or hypomania, which is a level that's less severe than mania.
And Chris, for you, since you experience it, how would you describe it?
Yeah, bipolar disorder, there's 2 major spectrums, the mania and the depression. I've only been full-blown manic once, but when I was, it felt like I was on the top of the world. When I'm depressed, it kind of feels like there's a constant and relentless winter in my heart.
Okay. So I guess most humans, we can be happy and we can be not so happy. The way you want to be through most of life then is halfway in between, doctor?
I mean, the goal is to feel happy, is to feel that you can experience emotion at a normal level. But when Chris becomes manic, his level of experiencing emotion is heightened.
What does manic mean?
Manic means it's an abnormal mood state where you're feeling overly energetic, restless, hyper. Your thoughts are disconnected and going rapidly. And you may think you're doing great. You may think you're on top of the world, but those around you see that it is not normal. It is too much. It's over the top.
Well, earlier in the segment, when we turned the screen to black and white, we did that because when we talked with you, you said that's kind of how you describe it. It's like you see some things as in black and white as in color. What do you mean by that?
Sure, I've always used the analogy that depression makes the world change from color to black and white. And it's not literal. I'm obviously seeing color right now. However, it's all metaphorical. And so it's like the mask you have to wear when you're depressed. It changes your viewpoint and perspective. And so that's just an analogy I've used because it's trying to simplify and normalize what these experiences are.
Let me see if this helps me. I'm going to put up a picture. You know Jessica Klein. You
Sure,
worked with her. She's our executive producer. Who's out on maternity leave. Every now and then she'll post a picture. She loves her little daughter.
Mila.
Mila, who's a couple weeks old. Now I see that and it brings me joy.
Yeah.
Could you ever look at something like that and not feel joy?
Yeah, so I think there's a big difference between happiness and joy. And I think happiness is a feeling, and when I'm in a depressive state, such as now, I don't feel happy, but I can always choose joy. I think joy is just something that you can prioritize in your life, and my faith and my hope and the love people show me allow me to choose joy even in tough
But you have
circumstances.
to concentrate on that joy?
Absolutely.
So
it's
like-
an active decision.
So when you see a picture like that, you're
Yeah.
choosing to say, wow, that's a baby, and oh, I know Jess, and this is great.
For sure. Oh yeah, I'm a big believer, to make the most out of every possible moment, but not every possible moment is able to be enjoyed.
Can you medicate this then? Doctor, why don't you answer that?
Well, there are many, many medications for bipolar disorder, but unfortunately, Chris has not had the response that we would have expected with medication.
Because it's like making a cocktail, you have to make it just
Yes,
right,
it's a
and adjust it.
combination. Yes, it's a combination of medications, and Chris and I we're still working on finding the right combination for him, so that he can better connect with with his life.
And how do you know when you have the right combination, though? It's just when things seem to be leveling out, or is it just, it's literally trial and error?
Well, I mean, it's based on research, and we do practice evidence-based medicine, and we look at the research.
Okay, if you scanned Chris's brain, does it look different than somebody else's brain?
It may or may not.
Okay.
If you look at patients who suffered bipolar disorder, there appears to be a reduction in the volume of the brain. And if you look at what area of the brain has, I mean, literally shrunk, it tends to be the area of the brain that is responsible for
Literally
emotional regulation.
shrinks. Now, he hit his head at one point. Would that cause it?
Well, we don't know. We don't know. We know that about 10% of patients who suffer from bipolar disorder have a history of head injury.
I want to touch on, Chris, because you mentioned, you said a state like you're in right now.
Yeah.
And you've said that in the seasons it kind of differs, which I never knew, that it could depend on the season. So the fall is usually hard for you?
Sure, yeah, fall has been historically harder for me. And this is actually, I just had to take my 4th medical leave of absence from Ithaca College, and all 4 of them have happened in the fall. So it's hard to say exactly what the symbolism is behind that. But with my bipolar disorder, I primarily experienced depression. And I think it's also important to note that I have had really wonderful times of stability, and I'm not constantly in an episode. In fact, for the vast majority of my experience with this illness, I've been stable. But right now, I'm just depressed and trying to fight on.
See those things? Can you read those? Have you felt these things? Impulsive? Do you have panic attacks?
I do not, no,
Yeah.
but I do definitely think that these are definitely representative of the bipolar experience.
So,
Wow.
so how will you know when you're ready to return?
Yeah, my goal is to return in the spring. I'm a big advocate for being in school and just maximizing all the opportunities that Ithaca College gives me. And so my hope is that Dr. Baldassano and I were trying a new medication, and I'm definitely hoping and praying that it's effective and that I'll be back ready to go in the
Keep
spring.
us updated, okay?
Yes.
Will do.
And thank you for doing this, because
Yes.
so many people
Appreciate
watching
that.
right now go, oh my gosh, I can relate. All right, thank
Yeah.
you,
So you've
Chris.
done a
you.
great thing.
Appreciate that.
We're
Thank you so
thinking of
much.
you.
Doctor, thanks.
And
Thank
here's the
you.
hashtag Fight On. We just want people to come together and to know more about this, about what you're going through. So
Yeah.
thank you for sharing
Thank
your
you.
experience.
Appreciate that.
Thank
Quick
you.
break.
Thank you.